indeed, there are 3 new cases of the coronavirus in Nipissing District, bringing the total active case count to 5. Well, 2 of the new cases are individuals from Chippewa Secondary School. They are believed to have contracted the virus away from school property. Meanwhile, the local health unit updated the situation via a virtual press conference late Monday afternoon.
2 of the individuals who tested positive are connected with Chippewa Secondary School in North Bay. The individuals were at Chippewa during their infectious period, meaning the students and staff in the same cohort as a positive case will be identified as contacts. The high-risk contacts have been informed to self-isolate, monitor themselves closely for symptoms, and to be tested for COVID-19. All high-risk contacts of a case of COVID-19 are required to isolate for 14 days from their last exposure to the case. If the contacts develop symptoms within their isolation period, the isolation period may be lengthened. An outbreak has not been declared at Chippewa as the 2 cases do not have an epidemiological link, meaning they are not in the same class or cohort, and transmission took place outside of the school. This aligns with the Ministry of Health's definition of an outbreak in a school. Schools are doing very well managing the protocol so far. The health unit has worked extremely closely with the school boards, and the boards have ensured administration at schools are well informed. Our call center specifically for schools remains open should any clarifications be needed. We're also supporting our schools with public health nurses should they require COVID-19 specific support.
7 months into the pandemic, the message from Dr. Chirico remains the same.
Asking the public really to continue to follow public health measures. Travel outside of the home should be limited to attending school or work if unable to work from home. Essential trips for groceries, medication, and medical appointments. And while we are still able to limit exercise and recreation to outdoor spaces where physical distancing is possible. Travel outside of our district, especially to high areas with high numbers of COVID cases, should be avoided unless for emergencies or urgent medical appointments. The only way to really reduce the risk of becoming ill and spreading the virus is to assume everyone we meet outside of our household has COVID-19 and ensure we follow public health recommendations to stay safe. In addition to the previously mentioned recommendations, please practice 2-meter physical distancing, use a face covering, wash hands frequently, and use alcohol-based hand sanitizer often. Cough, sneeze into your sleeve, avoid touching your face, and stay home from work or school if you feel ill or if you have COVID-19 symptoms, and arrange to be tested. No one can predict how severe or how long the second wave will last, but if we work together, we can help reduce the spread and save lives.